Welcome to WA Health and Care, your trusted source for authentic health education and natural wellness insights. In today's video, we'll be talking about measles, a highly contagious viral illness that continues to affect thousands worldwide, especially among unvaccinated populations. You'll learn what it really is, how it spreads, and the natural care methods that support faster recovery. With guidance inspired by international health experts from the UK and USA, WA Health and Care aims to make medical awareness simple, accurate, and easy to understand for everyone. Stay tuned, your health deserves the right knowledge. What is measles? Explained by WA Health and Care. Measles is a highly contagious viral disease that primarily affects the respiratory system and can spread rapidly among unvaccinated individuals. Caused by the measles virus, a member of the paramyxovirus family, it's one of the oldest known human infections and still remains a public health concern in many countries, including the United States and the United Kingdom. The infection begins when the virus enters the body through the nose or mouth and travels to the lungs and immune cells. From there, it quickly spreads throughout the bloodstream, affecting multiple organs. What makes measles particularly serious is how easily it spreads. Even brief contact with an infected person's cough or sneeze can transmit the virus. According to Dr. Emily Roberts, an infectious disease specialist at the Mayo Clinic, USA, measles isn't just a childhood rash, it's a systemic infection that can weaken the immune system for weeks, leaving the body more vulnerable to other illnesses. Similarly, the UK National Health Service, NHS, emphasizes that vaccination and awareness remain essential in preventing community outbreaks. At WA Health and Care, we aim to raise awareness about diseases like measles by breaking down medical facts into clear, reliable, and practical information. Understanding what measles truly is helps us recognize why prevention, early awareness, and vaccination are so vital for protecting families and communities worldwide. 1. What are the causes of measles? The primary cause of measles is infection by the measles virus, a highly contagious RNA virus belonging to the paramyxovirus family, specifically the morbillivirus genus. This virus is known for its ability to spread with incredible ease, especially in environments where people gather closely, such as schools, offices, or public transport. Measles is transmitted through respiratory droplets released when an infected person coughs, sneezes, or even speaks. These microscopic droplets can linger in the air for up to 2 hours, making it possible for others to inhale the virus without direct contact. In fact, the Centers for Disease Control and Prevention, CDC, reports that up to 90% of unvaccinated individuals exposed to the virus will become infected, highlighting just how contagious it truly is. Once the virus enters the body, it typically begins in the cells lining the back of the throat and lungs. It then moves into the bloodstream, spreading to other organs and weakening the immune system. This suppression leaves the body temporarily vulnerable to other infections, which is why measles is often more dangerous than it appears. According to Dr. Olivia Turner, an infectious disease expert from King's College Hospital, London, measles isn't caused by poor hygiene or bad habits, it's caused by a preventable virus that spreads faster than almost any other infection we know. The key lies in community-wide vaccination and awareness. In many parts of the world, including the United States and United Kingdom, the resurgence of measles cases is often linked to declining vaccination rates. When fewer people receive the MMR, measles, mumps, rubella, vaccine, the virus finds an opportunity to circulate again, even in countries where it was once nearly eliminated. At WA Health and Care, we emphasize that understanding the true cause of measles is the first step in stopping it. The measles virus itself is the culprit, but the absence of vaccination and awareness allows it to thrive. Protecting yourself and your community starts with knowledge, prevention, and a shared responsibility for public health. 2. What are the symptoms of measles? Recognizing the symptoms of measles early is crucial, as it helps prevent the infection from spreading to others and allows for better care during recovery. Measles usually develops in two stages, beginning with mild cold-like signs before progressing to more severe and visible symptoms. After exposure, the virus remains in the body for about 10 to 12 days before symptoms appear. This period is known as the incubation stage. During this time, a person may not feel sick or show visible signs, yet they can already spread the virus to others. The first stage of measles often resembles a regular flu or viral infection. Common early symptoms include fever, fatigue, sore throat, runny nose, and dry cough. The eyes may become red, watery, and sensitive to light, a condition known as conjunctivitis. Around this time, tiny white spots known as Koplik spots may appear inside the mouth, especially on the inner cheeks. According to Dr. Michael Reed, a public health expert from Johns Hopkins Medicine, USA, these small white spots are often the first internal sign of measles before the rash appears, and they help doctors confirm the diagnosis. The second stage begins a few days later with the appearance of the measles rash, a hallmark symptom. It usually starts on the face, particularly around the hairline and behind the ears, before spreading downward to the chest, arms, legs, and feet. The rash appears as small red or reddish-brown spots that may merge together, covering large areas of skin. Fever tends to rise significantly at this stage, sometimes reaching 104 degrees Fahrenheit 40 degrees Celsius. Patients often experience weakness, body aches, and a loss of appetite. The rash and fever typically last about a week, gradually fading as the body begins to recover. At WA Health and Care, we aim to help you understand that measles is more than a childhood rash, it's a systemic infection that affects the entire body. Recognizing these symptoms early and isolating the infected person can protect others and help prevent wider outbreaks within the community. 3. What are the exercises and care for measles recovery? Recovering from measles requires rest, nourishment, and gentle care. Since the infection can significantly weaken the immune system, the focus should always be on allowing the body to heal rather than pushing it with strenuous activity. During the recovery phase, the right approach to exercise and self-care can make a big difference in how quickly strength and energy return. According to Dr. Hannah Lewis, a wellness and infectious disease specialist at Cleveland Clinic, USA, measles recovery isn't about fitness, it's about rebuilding the body's defenses. Gentle movement and proper nutrition support the immune system without adding stress. This guidance reflects what medical professionals across the UK and USA consistently advise: rest first, then slowly reintroduce light physical activity once fever and rash have fully subsided. During the first 1 to 2 weeks after recovery, the body still remains vulnerable to secondary infections like coughs or chest problems. Therefore, complete rest and hydration are key. Drinking plenty of water, herbal teas, and natural fluids such as diluted fruit juices helps the body flush out toxins and maintain energy. Sleep is equally important. At least 8 hours a night allows the immune system to restore balance and repair tissue damage caused by the infection. Once strength begins to return, light stretching, deep breathing, and gentle walking can help improve blood circulation and boost mood. Avoid heavy workouts, running, or gym sessions until a healthcare provider confirms that recovery is complete. Exposure to fresh air and sunlight, in moderation, can also support vitamin D production, which plays a role in immune health. At WA Health and Care, we encourage a holistic approach, combining rest, nutrition, and gradual physical activity for full recovery. Remember, measles isn't just a surface illness, it temporarily weakens the body from within. Caring for yourself patiently ensures long-term wellness and reduces the risk of post-measles fatigue or complications. Recovery from measles should always be treated as a healing process, slow, steady, and guided by medical advice. Listen to your body, stay hydrated, and let rest be your most powerful medicine. 4. What are the precautions during and after measles? Taking the right precautions during and after measles is vital. not only to ensure a full recovery but also to prevent the infection from spreading to others. Measles is one of the most contagious viral diseases, and even a few careless actions can lead to new infections, especially among unvaccinated children and adults. According to Dr. Rebecca Collins, a public health specialist from Harvard Medical School, USA, precautions during measles aren't just about caring for yourself, they're about protecting everyone around you. Isolation, hygiene, and vaccination together form the strongest line of defense. This highlights the importance of responsible self-care and community awareness during an outbreak. During the active stage of the illness, an infected person should remain isolated from others, especially infants, pregnant women, and people with weak immune systems. Ideally, the isolation period should last for at least 4 days after the appearance of the rash, as this is when the virus is most contagious. Good ventilation in the sick room and regular cleaning of surfaces with disinfectant help reduce the spread of airborne particles. Personal hygiene also plays a critical role. Patients and caregivers should wash their hands frequently, avoid sharing utensils, towels, or bedding, and wear masks when close contact is necessary. Covering coughs and sneezes, even within the home, is a simple but powerful habit that protects family members. After recovery, the immune system remains slightly weakened for a few weeks. During this time, it's essential to maintain a nutrient-rich diet, stay well hydrated, and get plenty of rest. Avoid crowded places until the body's defenses have fully rebuilt. Vaccination of other household members, particularly those who missed earlier doses of the MMR vaccine, is strongly recommended to prevent reinfection cycles. At WA Health and Care, we stress that prevention doesn't end with recovery. True health awareness means continuing to protect yourself and others long after symptoms fade. Measles is preventable, but prevention works best when practiced collectively. By following these precautions, you're not only speeding up your recovery, you're helping build a healthier, safer community across the UK, USA, and beyond. 5. What are the natural treatment and home care for measles? When dealing with measles, there is no specific antiviral medicine that can eliminate the virus directly, but effective natural care and home-based treatments can help relieve symptoms, strengthen immunity, and speed up recovery. According to Dr. Michael Turner, a public health expert from Mayo Clinic, USA, the body's immune system is the real healer in measles. Natural care, rest, and nutrition create the best environment for recovery. At WA Health and Care, we believe in combining medical guidance with supportive home remedies that work safely alongside professional advice. Measles is a condition where comfort, hydration, and rest are your body's most valuable allies. During recovery, one of the most important steps is maintaining adequate hydration. Measles often causes fever, sweating, and loss of fluids, leading to dehydration. Drinking warm water, clear soups, and fresh fruit juices, like orange or lemon water rich in vitamin C, helps restore lost electrolytes and supports immune strength. Rest is equally essential. The virus weakens the body's defenses, so plenty of sleep allows your immune system to fight back effectively. Keep the patient in a quiet, dimly lit room to ease headaches and light sensitivity, which are common during measles. Nutrition plays a vital role in recovery. Soft, easy-to-digest foods like porridge, mashed fruits, and vegetable soups provide essential vitamins without straining digestion. Foods rich in vitamin A, such as carrots, spinach, and sweet potatoes, help repair tissues and protect the eyes, which can become irritated during infection. To reduce fever and rash discomfort, cool compresses on the forehead and natural baths with neem leaves or oatmeal can soothe the skin and lower body temperature naturally. Always avoid strong soaps or perfumed lotions on the rash, as these can worsen irritation. Lastly, boosting immunity after recovery is key. Continue eating balanced meals, take sunlight exposure moderately for vitamin D, and ensure everyone in the household is up to date with the MMR vaccination to prevent further spread. At WA Health and Care, our message is simple: natural care doesn't replace medical treatment, but it beautifully supports it. Combining both ensures faster recovery, stronger immunity, and a safer environment for everyone around you. Thank you for watching WA Health and Care. We hope this video helped you understand measles more clearly, from its natural care to essential recovery tips. Remember, your support keeps us motivated to bring authentic, research-based health guidance every week. Don't forget to like, share, and subscribe to stay updated with more medical and wellness content designed for UK and USA audiences. Now, we'd love to hear from you. Which topic should we cover next? Diabetes, migraine, or heart health?